It's me again! Nandito naman ako to talk about babies and moms. And pregnancy. Okay. So, pag-uusapan natin ngayon ay napaka-importante. Okay? As you can see, andito na naman yung boob pillow ko. Okay? I want to talk about one of the most problems that I have encountered in my nursing career and when I teach prenatal class ay yung tinatawag na flat nipple. Na maraming mga buntis, maraming mga babae dyan hoping to get pregnant o mag-asawa, na worried sila dahil flat yung nipple nila and they're worried na hindi sila makapag-breastfeed ng maganda because of the flat nipple. So, common problem talaga na na-encounter ko yan at sasabihin ko sa inyo ang possible solutions that can help you to prepare yourself or kung nagbe-breastfeed ka na ngayon at you're still experiencing this problem, kailangan manunod kayo or gather your friends para mas marami kayong matututunan. Okay, here we go. So, ang flat nipple, ang sabi nila, ang dahilan kung bakit flat yung nipple natin dahil when we were sorry, during our puberty time, hindi fully developed yung nipple natin. May ibang there are some women who their nipple are not fully developed, kaya hindi masyadong protrude yung nipple nila at nagiging flat. Okay. Ang problema ngayon, pag flat ang nipple mo, karamitan talagang number one suffering ng mga nanay after they gave birth ay yung struggle ng baby on how to latch with a flat nipple. Now, ito sasabihin ko sa inyo na hindi madaling solusyon on how to effectively latch your baby with a flat nipple, okay? Sometimes it depends on the shape of your breast. Meaning, kung malaki ang breast mo at flat yung nipple mo, tapos maliit ang baby mo, mag-struggle ang baby mo. Depende din sa baby. There are babies na perfect yung shape ng breast mo, although flat yung nipple mo, pero si baby naman ang may problema. Si baby yung mahina yung kapit ng lips dahil yung lips ay very thin. Mahina yung kapit ng bibig because the mouth is very small. May mga babies na talagang tiny little mouth at very thin lips na hindi talaga kayang mag-latch fully, deeply dun sa breast. When you say breastfeeding, it's a breastfeeding. It's not nipple feeding. Okay? If you got it? So, I'm pretending here. Oops, okay. So, if you are, I'm just going to use this model here. So, when the baby is breastfeeding, that's why it's called breastfeeding dahil si baby talaga, kailangan yung bibig, it's around, pass into the nipple. It's totally the breast. It's not nipple feeding. When you do nipple feeding, yun na yung bottle feeding. Okay? So, if you have a flat nipple ngayon, you're not pregnant yet or you're pregnant right now and you're worried na baka paglabas ni baby, hindi makalat si baby because you have flat nipple. Think about it. It is not nipple feeding, it is breastfeeding. So all you have to do para makalatch deeply si baby is making sure to hold your breast properly and position the baby properly para makapag-breastfeed effectively and efficiently kahit flat yung nipple mo. Now, if you are buntis ngayon or planning to get pregnant at worried ka na flat yung nipple mo, do the exercise. You can watch my previous video on how to exercise or massage your breast or your nipple. But I'm going to demonstrate it to you again today. So, I did this before, but I'm going to do it again. So, if your nipple is flat like this, totally flat, okay? Now, you want to hold your nipple right in the middle. Para bang pinipinch mo siya ng pagganon? Diba? Ano ba? I don't know what's that sign is. So you pinch it like this using your index finger and your thumb. So you pinch it like this. Okay, I'm just gonna go forward. Okay, you pinch it like this. Okay, and then you pull side side, pull side side. So you can do this one kahit nakahiga ka, or even when you're taking a shower, to make your nipple elastic or stretchy. You're preparing it para pag buntis ka na o pag nanganak ka na, yung nipple mo medyo stretch na siya. Okay? The shape of the nipple will return to normal after you quit breastfeeding. Okay? But some women would have problem to the fullest normal talaga. Minsan yung iba talaga, hindi talaga nagre-return into the normal shape bago sila nanganak. So, when you do this nipple exercise, or nipple massage, I call it. I teach this one pag nagtiteach ako ng prenatal class. When you do this one maybe 3 times a day, in the morning, or you're taking shower, o kaya nakahiga ka, it will really help na magiging elastic yung nipple mo. So, if you are breastfeeding now, at nag-struggle ka pa rin because of your flat nipple, I would suggest na change around the position on how you're holding the baby, okay? Or you can change the position on how you hold your breast. Now, I demonstrated this one before in my latching video. You can watch it again after you watch this, because there I really go through the whole latching process. But I'm going to do it again anyway. If you have a flat nipple right now, and you're breastfeeding, and you're still struggling because the baby cannot latch deeply, kasi ang kalimitan kasi pag nagpa-flat nipple at hindi magaling si nanay mag-hold ng breast, nag-i-slide yung mouth ni baby. So, nagiging shallow yung latch ni baby. Nagiging mababaw. Pag mababaw ang latch ni baby, the baby will not get the whole fat milk or the whole full milk. The baby gets tired, sucking and sucking, but then there is not full amount of milk the baby can get. The latch is very shallow. So it's always good to hold and position your hand properly when you are latching the baby with a flat nipple. Okay, so here's the thing. Now I want you to focus. I'm gonna just move my chair more forward here. Okay, so here's the thing. So when you are latching with what do you call this one? A flat nipple. I want you to hold your breast like a C. C. You know what a C? C letter. C. My thumb is right above the pink. Right above the areola. My finger, index finger, is right below the areola, the pink. So what I'm going to do is I'm going to sandwich it really thin. So when I do that, I want the baby to latch deeply without covering my areola. Kasi gusto ko yung mouth ni baby ay nandito talaga around full the areola. Pag i-block ko siya, this one, idikit ko siya closer, and this one, there is no room for the baby's mouth. You get it? It's always good to put the thumb up above the areola, index finger below the areola, and I see sandwich my breast, the breast, sorry, and hold it until the baby's mouth is fully intact, deeply into your breast, and then when it's in there, then you can let it go. Okay? Do not let it go right away. Hold it. Some women also, other position to hold your breast is when you do a pinch hold like this. See, I'm protruding the nipple, so helping the nipple to make more protruding, so the baby will be able to latch deeply with this, okay? Pinch hold, they call it pinch hold, a C hold, or a pinch hold, okay? You can do pinch hold this way as well. So making sure, latch the baby, and then release when the baby is in there, okay? You can do this latch, okay? You can do this latch if the baby is a full term, the baby has really strong mouth, the baby has really good thick lips that can hang onto the breast. Pero if the baby is a preterm, the mouth is not fully strong enough to hold, magi-struggle talaga si mom. So I would suggest if you are experiencing this problem right now, I would suggest continue latching the baby first. What also good is if you have a breast pump, after you breastfeed, pump your breast. Wait maybe 30 minutes or an hour, then pump your breast. Kasi yung suctioning of the breast pump would help to protrude your nipple as well. Okay? So, it takes a while. Hindi ka agad talaga na mag-protrude yung nipple mo. Because again, it's our skin, right? For how many years you have that skin na hindi nagpo-protrude, na talagang flat, it's gonna take a while for the skin to be elastic or to be protruding. So, kailangan talaga na patience, okay? Pag naglalatch ka, make sure talaga i-guide mo ang bibig ni baby deeply. Huwag mo kaagad i-release when you're holding your breast like this. Huwag mo kaagad i-release yung hand mo because when you release your hand, the baby's mouth will slide away from your breast. So that's one of the most problematic issues that I've encountered in our breastfeeding clinic with moms having problem with flat nipples. So I hope itong video na to, you gain some tips, strategies on how to latch a baby with a flat nipple. I'm going to do a video on how to latch inverted nipple kasi yun din ang isa sa mga pinaka-common problems din. So I hope you like this video. Please don't forget to subscribe, share this video, and do like this video and put your comments in there. See if you have any suggestions, any questions, and I promise that I will answer the questions that if you need some enlightenment about breastfeeding problem, because I know there's so many moms out there right now who are really looking for a breastfeeding educator or lactation consultant, but because of this pandemic, it's so hard to find support in your community from your healthcare provider. That's the reason why I'm doing this video. So please don't forget to subscribe, share this video so that you can also help your co-mothers or pregnant women out there who need support, who have this problem of flat nipple. And to be honest, in my nursing experience, probably out of 10 patients I have, probably half of them have flat nipple. So could you imagine that? And you know what's the worst thing is? The worst thing is when you have a flat nipple and your breasts get engorged when you're ready to breastfeed and you have tons of milk. The flatness of your breast make it more flat because again your skin is stretched just like this. Parang ganito, stretch na stretch, tapos flat yung nipple mo. So what happened? Lalong na-stretch pag full na full yung breast mo kasi hindi nagdidede masyado sa baby mo. So if you have that problem, I would suggest, if you're struggling for the latch, pump it first, maybe 5 minutes, pump, make it softer, then latch the baby. Because the tighter it is, the fuller it is, the hardest for you to latch your baby. So I hope you gained something today. Please like this video, follow me, and subscribe. I'll see you again in my next videos about babies, pregnancy, breastfeeding, and other things. Bye for now.